Hi, my name is Mark Taylor. I'm a consultant hepatobiliary surgeon in the Belfast Health and Social Care Trust. I'm absolutely delighted to be joined by Professor John Callan from the Ulster University, who's going to answer some questions today around really exciting research that is currently ongoing. John, you've been developing microbubble technology for the treatment of cancer for over 10 years. Tell us what it is.
Well, Mark, I think the simplest way to explain how our microbubble technology works is to think of the very liquid bubbles that we would have blown as children and then burst those bubbles using the pressure of touch. Our technology works the very similar way, except we use bubbles that are much smaller, about 100 times smaller than the diameter or the diameter of a human hair. And instead of using the pressure of touch to burst those bubbles, we use the pressure of an ultrasound wave. So we load up our bubbles with a combination of drugs. We inject a suspension of those drugs into the patient's bloodstream, and as they're passing through the pancreatic tumour, we use a focused ultrasound beam to burst the bubbles, releasing the drugs and activating the treatment.
So you've mentioned pancreatic cancer there, and tell me how this microbubble technology will work in pancreatic cancer, and particularly those individuals receiving chemotherapy.
A big benefit of our technology is the fact that it's targeted, and also the way that the microbubbles burst or explode helps improve the penetration of the drugs across the pancreas into the pancreatic tumor tissue. So not only do we get a much better effect, we do so by using a lot less toxic chemotherapy. So in addition to the improved efficacy of the treatment's also much better tolerated.
So you've had some very exciting results from the laboratory work, but we're about to enter into a human trial. When's that going to start, and how is progress with that at the minute?
Yeah, we're on track to commence our phase 1 clinical trial in the middle of next year, at the end of quarter 2 next year. That will be a single site clinical trial held here in Northern Ireland in the Belfast Trust, the Belfast City Hospital. And we've done a lot of work both in the manufacturing of the product and also engaging with the trust and the regulator, the MHRA, to facilitate the delivery of the trial.
In your opinion, this new technology, is there hope for patients with pancreatic cancer with regard to this in the future? And is there any other experiments or trials that are coming to the fore?
Well, we're very excited about this technology, and if the trial works even remotely as well as the laboratory experiments that we have undertaken so far, then we think it offers real hope for pancreatic cancer patients. In terms of emergent treatments, obviously a lot of focus now on trying to harness our own immune system to try and seek out and target the cancer cells and destroy the cancer cells, known as immunotherapy. And a big benefit of our treatment as well is that it works very well alongside these existing immunotherapy-based treatments.
If you had one message for the general public and indeed for healthcare professionals in relation to pancreatic cancer and really hope for all those individuals, what would that message be?
I think in the absence of a screening program for pancreatic cancer, and the fact that surgery is the only hope of a cure for pancreatic cancer, we have to increase the awareness of the early symptoms of pancreatic cancer, both among the general public and also among healthcare professionals, not just GPs, but also other healthcare professionals like pharmacists who will see the patients maybe on a more regular basis than their GPs and be able to identify, some changes in their appearance or their symptoms that may be indicative of, further investigation.
So obviously there's lots of research throughout the world looking at pancreatic cancer, looking at all cancers, personalised medicine, the role of local drug delivery systems. But ultimately, early diagnosis is the key. So what message would you have for the general public around early diagnosis in pancreatic cancer?
As surgery is the only hope of a cure for pancreatic cancer, and currently I think only 20% of patients that are diagnosed are eligible for surgery, and that's due to late diagnosis. So I think in the absence of an effective diagnostic technique, it's important that the public are become very familiar with the early symptoms and warning signs of pancreatic cancer, so they can get that diagnosis in a timely manner.
Professor Callan, we wish you all the best with this technology. I think there are many benefits for localized delivery of microbubbles, reducing the amount of chemotherapy that the individuals will get. And this could be not just the start of something exciting for patients with pancreatic cancer, but many other solid organ tumours. Thank you very much.
Thanks, Mark.